Today we're going to speak about communicating at the end of life. And as we begin, I would like to read you a letter from someone who has gone through the dying process, she has gone through it now. She actually wrote this at the end of her life. She writes, "All people want is to be treated with respect and kindness. Talk with them. Ask them how they feel about things. Don't ever make anyone feel that they're facing this alone. Stay with them and hold their hand. Cherish their lives. Let them know how special they are. Ease their fears and make them comfortable. Discuss their last wishes and ask them the hard questions about what they would want done if they stop breathing or their heart stops. Allow them to grieve, leaving this life and all that they have known. Help them be in touch with their physical and spiritual and emotional selves, and listen and love them." I want to go on, and we're going to talk some today about barriers, how it is that you can talk with someone in a family that's experiencing death and dying. How it is that at the end of life, it seems like people are just hanging on, waiting to hear something. Sometimes they're just waiting to hear it's okay to go. It's really okay. But people worry about different pieces when they're in the nearing death and awareness, and we'll talk about those as we go. So let's get started. Communication with a family or an individual who is experiencing death and dying is a very crucial requirement to success in palliative care. A terminal illness is truly a family experience. An individual does not go through this alone. The family always is affected, and they must be considered in the planning. There are some myths or untruths about communication. One of these untruths is that we communicate only when we consciously and deliberately choose to communicate. In reality, we communicate when we are not consciously aware that we are communicating. And we're going to talk more about that. Another myth or untruth is that words mean the same thing to our listener as they do to the speaker. Whereas in reality, words alone don't provide meaning. It is the interpretation of words that influences how others receive communication. A third myth or untruth is that we communicate primarily with words. In reality, the majority of the messages that we send are nonverbal. Another myth is that communication is a one-way activity, but in reality, communication is a two-way activity. And last, as a myth or untruth, one can never give someone too much information. In reality, people can feel overwhelmed when they receive too much information. The lines of communication must be clear. If you are working with families or an individual that's experiencing death and dying, you need to be honest and truthful with them. You need to assure them that you're never going to abandon them, no matter what they say or what they share with you. You want to talk with them and elicit their values and their goals. And I have a handout that it's an upload in this module. It's called Questions to Ask Families to Elicit the End-of-Life Goals. And so if you'll pull that up or print that out, these are some of the questions there that you'd want to ask them. What do you think is most important to your family? What do you identify as your needs at this time? What are your concerns at this time, and what are your concerns about the future? what you're trying to elicit from the family and from the individual is, where is it that I can go with you, or that we can go together as a family or as an individual, with a healthcare provider, as a social worker, as a friend? Where can I go with you, and what can we talk about so that death is very meaningful to you? We've talked before that death is just part of the natural life cycle. So this part is important too. What are the kinds of things that you would like to accomplish in the time that you have left? Is there anyone in particular you would like to talk with or visit with? By having these kinds of conversations and taking time to listen, you're going to elicit the values and the goals of the dying individual, as well as the family that's going through this process as well. So that when it's all said and done, the family can look back and say, that was really a good experience. Even though my father's not here with me anymore, we had some really good talks at the end, and I'd never really had that opportunity to talk with him about what he thought was important. And we got to do such and such. It can be a very good process, but good communication is just critical. You have to take time and listen. Listening can be a very hard role sometimes. We'll talk more about that. You need to be aware and sensitive to cultural differences. If this is a professional call of yours and you're working and dealing with palliative care, you've got to be very careful about the individual's sexual orientation, what their religious beliefs are, their age, and what is important to them. Maybe it was, if they're a baby boomer, they were born between 1946 and 64. You can identify with some of the beliefs that they may have, and this would affect their communication, as opposed to a Generation X or Y, which are much younger. Ethnicity and gender, all of these are very important to take into consideration as you have these conversations. Communication is an ongoing, continuous, dynamic process, and it includes both verbal and nonverbal signals. Some examples of our nonverbal signals are like our body language, our eye contact, our gestures, our tone of voice. Those are the kinds of things that we don't have to say anything. For example, if someone says something to you and you roll your eyes at them, you've already sent them a message right then. There are lots of nonverbal. In fact, 80% of communication is nonverbal. So the body language and the gestures and the tone of voice, all of those kinds of things that are nonverbal are considered, or it represents 80%. However, 20% is only verbal. It's actually what we say. In communication, you do need to find out how much the patient or the individual, the family, they would like to know. It might be that you might be invited to come to a family meeting. If you might be a friend of the family, you might be someone from the church, clergy, you might be a healthcare provider, social worker. Just a word on communicating with children, and I have given you a handout to upload or to print out. When you're working with children that are dying, you always want to give the information that's given to the developmental age of the child. Remember that younger children tend to be concrete thinkers, and older children are very capable of abstract thinking. So let the child's questions guide. In other words, begin the conversation with basic information, and then let the child, question, and that will direct the conversation. And look for clues that the child is open to communication. Whatever emotion is expressed, be accepting. And that goes with all ages. Whatever is told to you or shared with you, be accepting of it. If you want to make sure that the child understands, you want to encourage them to maybe to summarize what they've heard in their own words. And that way, if there's any misunderstanding, if there was some information about their disease or their illness that they ask you about, you can make sure that they're clear. And there are other things besides talking and verbal communication that can impact a child. Sometimes books and movies, depending on the age, can encourage that dialogue. Games and art and play, all those are expressions, and those doors should be open for those types of expressions to be utilized at the end of life. Children it's a very sensitive area, and it takes some time and some to I guess get some expertise in this area, because a life that is short and not long standing, it's very hard for many people to address that and work within that environment. Whereas an older adult, while it's still hard, it's in the context of a life lived in a long time. Whereas a child, it may only be a few years. Listening is probably the most important component of communication. And sensitive listening is being present, not just physically, but mentally and emotionally as well. You want to, in attentive listening, you don't want to anticipate what's going to be said. You just want to listen. Do not interrupt the talker. And encourage that patient, the family member, the individual to talk. You know, you can encourage this in several ways. You can simply nod your head that you're listening. Comments like, I see, or tell me more. You can repeat 2 or 3 words from their last sentence. Oh, so you were shocked by the diagnosis. You can reflect on what they've said, so that you're sure that you're understanding what they said, but it also encourages them because they know you're listening. So when you reflect, you would say something like, oh, so you mean that, or perhaps, if I understand what you're saying, you're feeling, and then move on. You want to ask open-ended questions rather than closed-ended in communication. And what I mean by this is do not ask yes or no questions. Ask questions that are, well, share with me how, or statements, share with me how you're feeling about such and such. Or tell me more about so-and-so. That encourages people to talk. And sometimes there's times in attentive listening to be silent. Silence does not always mean that the person, the individual, does not want to talk. Sometimes you're silent, sometimes they're silent. If your dying individual or family member doesn't talk, it might mean that they're deep in thought about something that might be painful or sensitive to them. Give them time so that they can talk without feeling rushed. As a nurse, I have cared for dying patients. I've also had the privilege to sit at the bedside of someone that was passing on and hold their hand during those last breaths of life. And sometimes when I've had patients that were dying, I would be in their room, and I didn't really say anything. Other than I've had some extra time on my shift, and I wanted to spend it with you. And go in there and sit in their room. Sometimes they would talk, sometimes they wouldn't. But I could tell just that gift of presence. Somebody that cared enough about them to sit by them, give them a little bit of their time, it meant a lot to them. You know, and sometimes you may not know what to say either, and there are times when there really isn't anything to say. So sometimes saying nothing, but remaining close physically, sitting beside the bed, can sometimes offer more comfort than words. Your presence and your being with are very vital forces. And it's okay to acknowledge your feelings. It's okay to say things like, this is difficult for me to talk about also, or I don't know what to say. Sometimes families or patients will say to someone that's listening, why is this happening? I'm here to tell you it is okay to answer, I don't know. I wish I had an answer, but I don't. It's okay to say that. You want to avoid misunderstanding. If you're unsure what someone has just said to you, if you understand it, that's fine. But if you're not sure and you want to clarify, it's okay to say, help me understand what you mean. When you're an attentive listener, you don't change the subject, even if you're uncomfortable with the topic. This is sometimes a natural response we use to avoid difficult conversations. But with someone who is dying and in this process, or their family member, don't change the subject. You're cutting them off and shutting them down. And what you want is to give them an opportunity to talk. Ask questions rather than give advice. Many times, as adults, we want to fix things or give them the right thing to do. At this time of life, there's really not want something. But you can ask questions like, when they mention something, you can say, well, have you thought about such and such? Or when I was close to someone else that was also dying and going through this phase of their life, they tried and so. You can make suggestions, but do it more so very unassuming. And last, encourage reminiscing. Giving your individuals and your families an opportunity to reminisce about what happened in the past. Tell their story. What that does, it provides reassurance to the individual and to that family that their lives actually had meaning, and they did. And we need to revisit that at this time of life. There are some factors that influence communication, and I felt like I needed to bring this up because sometimes it's difficult to talk about death and dying within a family. And many times your communication barriers are actually your fear of your own mortality, the fear of not knowing what's next. I don't have the answers to the questions, so people change the subject. We've talked about those issues today. And it's a lack of understanding the culture, so you're not clued in to what's important to them. And it's okay to ask that. You know, in the final hours or days or weeks of life, dying people often make statements or gestures that seem to make no sense. Family members or friends may say, oh, her mind is wandering, or he doesn't know what's happening now. It's not unusual for an onlooker, however well-meaning, to speak of the dying person as, oh, they are out of it, or they are losing it, or they're not quite right anymore. Healthcare professionals, friends, acquaintances, they may label these expressions as confusing, or maybe they're hallucinating. And I want to share with you that might not be the case. When we talk about nearing death awareness, it's a special communication of the dying. And it usually occurs when an individual are approaching or in the dying process. And usually they're much more peaceful after this experience. but not everybody has this experience. So let me tell you about the signs of nearing death awareness. They may appear confused and disoriented. They may state that they have spoken to somebody that you know has already passed on and died. They may speak to people that you can't see. It might be, "Oh, Mom, I like your hair that way." Well, their mother died 30 years ago. They may see places that aren't visible to you. They may describe spiritual beings and bright lights. They may talk to people who have died before them, their father, a close friend. They may make out-of-character statements or requests. They could describe another world of peace and beauty. They may actually tell you exactly when they will die. And they may make hand gestures, reach out for things that are unseen, objects, or maybe even wave to unseen beings. These behaviors do not mean that they are confused, hallucinating, or having a reaction to their medications. It is believed that people are beginning to transition from this life into the next. The person may be trying to describe a dying experience or something they need to do before they die. They actually may be a symbolic communication to ask for permission to die. Some may say things, "I need to pack my bags, I need to get on this plane." Someone who has had a life at sea or do a lot of boating, they may talk about the tide is here and I'm waiting for the tide to come in so my boat can take off. A rancher may describe his horse, waiting for him to take a ride. What you can do in this is don't contradict them or try to explain away or belittle them or argue with them, because these experiences can be very comforting. You just want to be present with them. Simply sit at their bedside and be open to their attempts to communicate. Listen attentively, as we've talked about today. Acknowledge the experiences. And it's okay to say, "Who do you see? How does that make you feel?" And allow them to share that with you. When people experience nearing death awareness and describe death as peaceful, they are providing others with a better understanding of the death experience, and this actually may be their final gift to you. It is okay to tell one who is going through the dying process, it's okay to let go. You fought a good fight. You've lived a good life. I've enjoyed having you here. You've been so special to me, but it's time to let go. And many times they're waiting to hear things like that. In summary of our talk today, we've talked about communication concepts. We've talked about the barriers that are faced and why those barriers are there. And we've talked about some of the responses that you can make as you are helping and assisting a family or even an individual who's going through the dying process, which is just part of the life cycle. We know that communication is very complex, with 80% of the communication being nonverbal. You must involve your individuals, your patients, your families. It is a family affair, if you will. And this picture just shows it is truly a family affair. This ends and concludes our process today on communications and the end of life.